Dependent personality disorder is a type of personality disorder, mental health issue. Look at this picture, shows that dependent behaviors. Look at this. And MRI, brain regions involved in dependent personality disorder. Detail going on. Introduction. Dependent personality disorder is one of the 10 personality disorders recognized in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. It is a chronic condition marked by pervasive and excessive need to be taken care of, leading to submissive and clinging behaviors and fears of separation. People with DPD often have difficulty making everyday decisions without an excessive amount of advice and reassurance from others. A definition: dependent personality disorder is defined as a pervasive and excessive need to be taken care of, which leads to submissive, clinging behavior and fear of separation. This pattern begins by early adulthood and is present in a variety of contexts. Etymology: the term dependent personality disorder comes from the Latin word dependent, meaning to hang from or to be reliant upon, reflecting the individual's excessive reliance on others for emotional and decision making support. The word personality is derived from the Latin persona, meaning mask, symbolizing enduring patterns of behavior, while disorder implies a disruption in normal functioning. Epidemiology: dependent personality disorder affects approximately 0.5 percentage to 1.5 percentage of the general population, with high prevalence reported in clinical settings. It is diagnosed more frequently in women than men, although this may be influenced by cultural and diagnostic biases. Types: while DPD is not classified into distinct subtypes in the DSM-5, clinicians sometimes categorize patients based on behavioral tendencies. One passive dependent type characterized by helplessness, submissiveness, and fear of responsibility. Two active dependent type actively seeks attention and support from others, often manipulative to maintain dependency. Causes. The exact cause of DPD are unknown but are believed to result from a combination of 1. Genetic predisposition, 2. Early childhood trauma or neglect. 3. Authoritarian or over protective parenting. 4. Cultural or societal influences that promote dependency. Risk factors. 1. Family history of anxiety or personality disorders. 2. History of childhood abuse or neglect. 3. Chronic illness during childhood. 4. Overprotective or authoritarian parenting. 5. Low self esteem and chronic fear of abandonment. Complications. If left untreated, DPD may lead to 1. Depression and anxiety disorders. 2. Substance abuse. 3. Relationship dysfunction. 4. Poor decision making and victimization. 5. Difficulty with independency in adult life. 6. Suicidal ideation if relationships are threatened. Pathophysiology. Pathophysiology of dependent personality disorder. Step by step process. 1. Genetic predisposition. Individuals may inherit traits such as anxiety, insecurity, or sensitivity, which can predispose them to dependency traits. Studies suggest a family tendency towards anxiety and personality disorders. 2. Early childhood experiences. Children raised in overprotective, controlling, or authoritarian environments may not develop autonomy. They may be discouraged from making decisions or expressing disagreement, fostering dependency. 3. Disrupted attachment development. Insecure or anxious attachment to caregivers during early development can hinder the development of self confidence and independent identity. The child learns to rely on others for emotional security. 4. maladaptive cognitive patterns. Individuals internalize irrational beliefs such as I cannot survive alone or I must have others to guide me. These core beliefs contribute to low self efficacy and fear of abandonment. 5. Behavioral reinforcement. Dependent behaviors, example seeking reassurance, avoiding decisions, are positively reinforced when others respond with support or assistance. Over time, this reinforces the belief that dependence is the safest coping mechanism. 6. Neurobiological factors. Dysregulation in brain circuits involved in anxiety, emotion regulation, and social attachment. Example, limbic system, prefrontal cortex may contribute to persistent dependence and emotional insecurity. 7. Chronic behavioral patterns. The above factors culminate in persistent patterns of dependent behaviors, including clinging, submissiveness, and avoidance of responsibility, which become resistant to change without therapeutic intervention. Signs and symptoms. According to the DSM-5, individual must display at least 5 of following. 1. Difficulty making everyday decisions without excessive advice or reassurance. 2. Needs others to assume responsibility for major areas of life. 3. Difficulty expressing disagreement due to fear of loss of support. 4. Difficulty initiating projects due to lack of self confidence. 5. Goes to excessive lengths to obtain support and nurturing. 6. Feels uncomfortable or helpless when alone. 7. Urgently seeks new relationship as a source of care when a close one ends. 8. Unrealistic preoccupation with fears of being left to care for oneself. Diagnosis. Diagnosis is typically made by a mental health professional using 1. Clinical interviews. 2. Personality assessment. Example, Milone Clinical Multi-Axial Inventory. 3. DSM-5 criteria. 4. Exclusion of other mental disorders such as anxiety or depressive disorders. Nursing diagnosis. Common nursing diagnoses may include 1. Ineffective coping related to dependency needs. 2. Low self-esteem related to lack of confidence in decision making. 3. Anxiety related to fear of abandonment. 4. Impaired social interaction related to clingy behavior. 5. Powerlessness related to inability to function independently. Medical management. 1. Pharmacotherapy, not primarily but used for comorbid conditions including antidepressants for depression or anxiety. Anxiolytics, short term use. 2. Psychotherapy, primary treatment approach. Cognitive behavioral therapy (CBT) is most effective. Insight oriented therapy and interpersonal therapy may also help. Nursing management. 1. Establish trusting therapeutic relationship. 2. Encourage independent decision making. 3. Educate about assertiveness techniques. 4. Monitor for signs of depression or suicidal ideation. 5. Reinforce positive behavior changes. 6. Encourage involvement in group therapy for peer support. Treatment options. 1. Cognitive behavioral therapy (CBT) helps change irrational beliefs about helplessness. 2. Psychodynamic therapy explores unconscious motivations. 3. Interpersonal therapy focus on improving relationships. 4. Group therapy encourages social interaction and independence. 5. Medication for comorbid depression or anxiety. Psychosocial medicine. 1. Assertiveness training, teaching how to express needs and desire appropriately. 2. Support groups, reduce isolation and improve social skills. 3. Self esteem building activities focused on strengths and achievements. 4. Family therapy, educating family members about healthy boundaries. 5. Vocational and life skill training promotes autonomy and confidence in handling life tasks. Prevention. While DPD may not be fully preventable, step can reduce risk. 1. Fostering independence in childhood. 2. Encourage autonomy and self confidence. 3. Avoiding overprotective parenting style. 4. Early intervention in children showing dependent traits. 5. Promoting healthy coping strategies for stress. In conclusion, dependent personality disorder is a chronic, disabling condition characterized by a pervasive fear of abandonment and an over reliance on others. Although it can severely affect personal, social, and occupational functioning, early diagnosis and appropriate intervention, especially through psychotherapy, can significantly improve outcomes. Empowering individuals through psychosocial support and skill building is essential to help them lead more independent and fulfilling lives. Thank you. Have a nice day.